So today I've got Dr. Ross Hauser. He's a health pioneer and he's been involved in regenerating joints and treating people for, I think, 26 years, Dr. Ross?
Yeah, January 93 is when I started. So yeah, we're in our 28th year, Steve, of doing prolotherapy. And as you know, I wrote a bunch of books on it. And one of my specialties, as you know, is how to regenerate joints in the neck, and then how neck problems and stress cause vagus nerve degeneration, which I think is really the epidemic that's going on around the world now.
Great. Well, welcome to the show, Dr. Ross Hauser. It's a privilege to have you. You can just Google this man and you'll see articles and books and research. His website is www.caringmedical.com. So he's just a rich resource of information, knowledge, and wisdom with regards to the spine, any joint actually. But today we're going to focus on the vagus nerve and dysfunction of the vagus nerve, because there's some incredible crazy symptoms out there, from gut dysfunction, to anxiety, depression, to circadian disruption and disruption of rhythmicity, of our circadian rhythmicity. And so can we just start off and just tell us about stress and how it affects your autonomic nervous system, Dr. Ross, and what is the autonomic nervous system?
Yeah, Steve, I actually want to start with like animals. So in animals, for an animal to live, the animal has to have functioning vagus nerves. So the vagus nerves are the nerves that basically keep you alive. Then for an animal to handle stress, they have to have sympathetic nerves. Sympathetic nerves help the animal live when the animal is subjected to stress. Like an animal, if you cut the sympathetic nerves, and the sympathetic nerves in the body are the nerves that respond to a stress, and they're called fight or flight, meaning that if somebody comes up to you and says, "Hey, dude, give me your money," right, and he has a knife, your blood pressure is going to be high, your pulse rate is going to be high, like your body gets ready for a fight. So in other words, an animal, an animal can, like for instance, if you cut the sympathetic nerves in an animal, they don't have any sympathetic nerves. If the animal has enough food and it's peaceful, the animal can live because the vagus nerves are there. However, if the animal is subjected to stress, the animal dies. So in other words, our adrenaline nerves or sympathetic nerves, our fight or flight nerves, allow us to handle stress, but they were never meant to be active all the time. So in other words, if a person feels stress all the time, what happens is that the stress starts to damage the vagus nerves. Now, an animal, the vagus nerves are what give the animal calmness, rest, peacefulness, and many people call the vagus nerves the love nerves or the joy nerves. Like everything in life that you experience or that we enjoy, family, love, walking on the beach, peacefulness, all those sensations are carried through the vagus nerve. So the vagus nerves are called the rest and digest nerves, meaning that to calm the body down, the vagus nerves become active, and they help produce hormones, which we'll talk about, and the substances that you and I need to feel happiness, to feel love, to feel peacefulness. And then for you to properly digest food, remember we said the vagus nerves are called rest and digest. So to digest food, you have to have functioning vagus nerves. So if you get overwhelmed with stress, what happens is you start damaging the vagus nerves. And once you start damaging the vagus nerves, your body has a limited ability to fight infection, to handle stress. And by stress, we mean anything: emotional stress, an infection, pneumonia, a boss that's not good, your marriage, your children, any sort of stress your ability to handle stress depends on how strong your vagus nerves and how strong your vagus nerves we call vagal tone. So somebody who has a really strong vagal tone, a very peaceful, calm person, they can handle unbelievable amounts of stress. And as it relates to infections, right, we're in a global pandemic or whatever, your ability to fight an infection totally relates to how strong your vagus nerves are. So, and of course, we'll talk about how the cell phones and the way modern life is, it's basically damaging everybody's vagus nerves. So their ability to handle stress keeps going down, down, down. And of course, you feel then anxious all the time. And of course, you're showing others to try to get people to live to thrive. You have to have a high vagal tone.
Right. So, but just tell us about the vagus nerve. Where does it start? Where does it go? I know that it's called the wanderer. You know, what part of the nervous system does it relate to?
Okay. So, you know, you had alluded to the autonomic nervous system. That's the part of the body that occurs automatically. Like right now, you're not telling your body, hey, my finger needs blood. Like it just happens automatically. Or you eat a food, and I'm sure you eat organic, you know, a lot of vegetables and stuff. So when you're digesting food, you don't tell your body, hey, we need more blood flow to the stomach. So most of the nervous system is the autonomic nervous system. That's everything in our body that happens automatically. Like in other words, the blood pressure. And blood pressure is just the pressure against which the heart has to pump enough blood to your head, to the bottom of your foot, your pulse rate. And so all the things that allow the body to live, that's controlled by the autonomic nervous system. There's two parts to the autonomic nervous system. One is the parasympathetic, which that's the main nerve there. You know, 90% of the nerve input to the brain from the parasympathetic is the vagus nerves. And that's the part of the nervous system that gives you health. So if you're not healthy, the part of the nervous system, autonomic nervous system, that isn't working in you is the vagus nerve, basically, the vagus nerves. Then the other part of the nervous system helps you handle stress, which is the sympathetic nervous system. So the vagus nerves, there's two vagus nerves, Steve. They each run from your brain stem. So I just want to give everybody an anatomy lesson. You have your brain, which I call central command. Your brain is central command. Then the brain hooks up to a relay center called the brain stem. So the brain stem's about right here. It's right above your spine. Then the brain stem is all the relay centers. That's where the relay center for blood pressure, breathing, nausea, your autonomic nervous system, you know, so that's like all the relay centers. Then you have the spinal cord. The spinal cord is how the impulses go from the body to the brain, from the brain to the body. Now the main highway, this is really important, the main highway through which the nerve impulses give information to the brain, the main highway are the vagus nerves. So the vagus nerves are the most important nerves in the body. The vagus nerves. There was one on the right side of the neck and the left side of the neck. They go from the brain stem to the abdomen. So they go way deep in the abdomen. They're the largest nerves in the body. Now, what's important about the vagus nerves, and a lot of this stuff the people will know, but some of the stuff, because you know your viewers are obviously highly educated, but the vagus nerves and all the nerves of the body are made up of nerve cells called neurons. This is really important, neurons. So neurons, there's 100,000 neurons in this vagus nerve and this vagus nerve, 100,000 neurons. Now that may seem like a lot, but it's very little. There's over 1 million neurons in the eye, each eye. There's over 1 billion in the brain. So in other words, you could be a rugby player and keep getting hit on the head, or a fighter, and you know your brain still can function good. Your vagus nerves do not have a lot of extra neurons. There's only 100,000. And the ganglion, so let's just talk about that because this is really important. A ganglion is where the brains of the nerve cells reside. So in other words, what tells the vagus nerve what to do and what directs all the flow in the vagus nerve, so the vagus nerve has proper nutrition, is called the ganglion. So the important thing is the main ganglion where the brains of the vagus nerve sit is right in front of the first cervical vertebrae. So that's called the atlas or C1. C1. So in other words, the most important nerve in the body are the vagus nerves, and the brains of the vagus nerve sits in front of C1. That's called the inferior vagus ganglion or the nodose ganglion. That's very important. And the reason why it's important, and I'm just going to illustrate me. So most of us work on a cell phone or we work on the computer and we're like this, you know, we're all hunched over. So what happens is, and I'm going to use this model, you know, this is basically, and I took away the ligaments, but this is like the head. This is actually your atlas. This is what it looks like. This is your atlas. And this is the dens. That's what your head rotates around, right? Your head rotates around. So this is, so in other words, the vagus nerve one sits right here and one sits right here. So if you have a forward head posture, right? So you have a forward head posture. So what happens is it's basically you're like this. So in other words, your head, which weighs like 12 pounds, the atlas only weighs 2 ounces. So what happens is, as you have forward head posture, we're looking at a cell phone, the atlas goes forward. And when it goes forward, it starts hitting the nodose ganglion. So basically you're taking out, by cell phones, you're taking out structurally the vagus nerve. And once the vagus nerve neurons start to die, guess what? Nerve impulses don't go into the highway, the main way that nerve impulses go with the vagus nerve. So then your brain doesn't get the right information from the stomach, from the gallbladder, from the intestines. The brain doesn't even get the right information about what's going on with your immune system. It doesn't get the right information, Steve, in regard to blood pressure, pulse. It doesn't even get the right information about what's going on with your marriage, your kids. And so what happens is there's an imbalance between the calming system and the stress system. So it's like a seesaw, and the sympathetic system or the stress system keeps getting higher and higher and higher because you don't have something that calms it down. So the vagus nerve is what inhibits the stress system. So in other words, the nervous system that balances the stress system, the sympathetic system, is the vagus nerve. And if your vagus neurons die, basically what happens is you have no ability to handle the stress that's going on with your life. And what I do is call that structural anxiety. Like somebody has anxiety or they have no ability to calm themselves down because they have degeneration of their vagus nerve. So it's like a catch-22. You don't even realize it's happening, that your vagus nerve is getting damaged and it can't function properly. And then all of a sudden the stressors stress you out more. And then the stress itself starts damaging the vagus nerves. And then, of course, once you can't control inflammation in the body, control stress, you could get cancer, you could get Alzheimer's, you get Parkinson's disease, you get unbelievable amounts of obsessive compulsive, general anxiety disorder. So obviously you're doing this show just to educate people that you actually might have a structural problem causing your vagus nerve. And then, of course, we'll talk about very easy things at home that you could tell whether or not you have a vagus nerve problem.
Great. A lot of information there. So that's the sort of mental symptoms, the anxiety, depression, OCD symptoms. But what about the physical symptoms you can get from structural sort of anxiety or structural sort of interference of your vagus nerve? Physical, what about emotional symptoms? Let us know about that.
Yeah, if you go on the internet, you'll hear the term dysautonomia. So whenever you type in like autonomic nervous system and dysautonomia, that's what we're talking about. Dysautonomia just means your autonomic nervous system isn't working correctly. Okay. So I'm just going to go through the various organ systems and what happens. So in other words, when you have the autonomic nervous system isn't working right, and it normally isn't working right because the sympathetic system is too high, the stress system, and the vagus system is not working good. Okay, so in other words, think about if you were a hostage. So you're a hostage and you might die. You're a political prisoner or whatever. All the things that you would experience there can be caused by low vagal tone. So think about that. You would feel anxious. So anxiety is a symptom. You would feel so fatigued, unbelievable fatigue. It doesn't matter how much you rest, you're going to get unbelievable fatigue. You can't sleep. So you have horrible sleep. Then your blood pressure control, I just call it schizophrenic. Your blood pressure could be really low or your blood pressure could be really high because your body can't monitor your blood pressure because the blood pressure sensors, they're in your carotid artery and your aortic arch. The blood pressure sensors aren't working. Then, of course, your digestive system is off. You could be constipated. You could have diarrhea. A real common symptom is from gastroparesis. Your stomach isn't working right, so you feel nauseated all the time. You feel bloated all the time. You have to eat less and less food, and basically what happens is you lose a lot of weight. So if that's anybody who's listening to this, you probably got low vagal tone. Something's injuring your vagus nerve, which normally is problems in your neck, which we call cervical instability. You need the vagus nerve to secrete hormones. So if you have low hormones and nobody can figure out why, you can even have low growth hormone levels, and that can be from low vagal tone. You could have what's called autoimmune diseases, because if you research on Google or one of the search engines and you put in cholinergic anti-inflammatory system. So the main neurotransmitter in the parasympathetic nervous system is called acetylcholine. Well, it turns out acetylcholine, the main nerve impulse that makes acetylcholine is from the vagus nerve. So in other words, you're sitting there with your animal and you're petting your animal, that's increasing your vagal tone. And what's happening is you're making acetylcholine, and that acetylcholine, that cholinergic nervous system is now resolving inflammation in your body. So if you've been diagnosed with lupus, scleroderma, rheumatoid arthritis, connective tissue disease, or they don't even know why your C-reactive protein, your sed rate, or your inflammatory markers are up in your blood, I'm just telling you, by definition, because your body can't resolve the inflammation, you have low vagal tone, you have dysautonomia, your autonomic nervous system isn't working. So you need to increase your vagal tone, which I'm sure, of course, we'll talk about how to increase your vagal tone. And then in the neck, what can happen is if your vagus nerve, the vagus nerve is, as far as the face goes in the brain, it's very inhibitory, meaning that it inhibits the sympathetic nervous system. So the sympathetic nervous system, what it does is it clamps down blood vessels. So if you have any part of your body, including your brain, where it doesn't seem like there's not enough blood flow, it's probably the vagus nerve isn't inhibiting the sympathetic system, so you have a decreased blood flow to the brain. So just think about, if you had decreased blood flow to the brain, what could that cause? What could cause anything? It could cause dizziness. It could cause lightheadedness. It could cause, in the inner ear, it could cause where you have ear fullness. You have Meniere's disease. You have where you can't hear. One of my patients, I treated them a few times with this treatment called prolotherapy. Their vagal tone increased, then they didn't need their hearing aid anymore. They totally didn't need their hearing aid. So if you had decreased hearing, vertigo, low blood pressure, like we said, high blood pressure, swallowing difficulties, all the sphincters, think about all the sphincters, Steve, your upper esophageal sphincter, lower esophageal sphincter, your pyloric sphincter, your gallbladder sphincter, all those sphincters are under the care of the vagus nerve. So if you've got gallbladder disease, liver disease, you have gastroesophageal reflux, you have where you have all these food sensitivities, multiple chemical sensitivities, all these things, if you get under a good natural medicine program and it's not really resolving it, it's probably the cause of it is structural. And you got to look at, maybe it's your no-dose ganglion in your neck, that's in the neck that's getting damaged, and you have to get that resolved.
Right. It seems like this nerve affects all different functions, the GI system, your cardiovascular function, even all your nerves in your brain and down your spine. I mean, it looks like there's a system that it doesn't affect. That's incredible. Tell us how the vagus nerve, affects the hypothalamus, pituitary, adrenal axis, so people know about the HPA axis and adrenal burnout or adrenal fatigue or adrenal stress. How do those two link?
Okay. No. So then what we said is the cell bodies of the vagus nerve, they go to the brain stem. So in other words, they're in the medulla. So as you know, the medulla, it sits basically right above the cervical spine. So if you have problems with your cervical spine, it's going to affect the medulla, which we'll talk about. Then those projections from the vagal nuclei in the medulla, they go to the hypothalamus. So in other words, they're stimulatory toward the hypothalamus. So in other words, the main relay center, if you will, that makes hormones, that makes your body make hormones, the hypothalamus, that's affected by the vagus nerve. So when doctors do vagus nerve stimulation, so there's actually stimulators that you can get to stimulate your vagus nerve, electrical stimulators, that they've shown that there's increased blood flow and nerve input to the hypothalamus, which then causes the hypothalamus to make releasing factors, which go to the pituitary. Well, it's stimulating releasing factors. Then the stimulating factors from the pituitary go to like the thyroid, go to the adrenal gland. So in other words, a person who's been diagnosed with like low cortisol or low thyroid or has adrenal fatigue, like obviously if you have adrenal fatigue, you got to do all the things, rest and good nutrition and all that, but it could have a structural cause. It could have a structural cause where the hypothalamus and the pituitary aren't functioning just because they don't have the neurologic input that they should. Let me just say that we've just gone through what you might consider the chemical age of medicine, right? Like in other words, we've done a great job of evaluating the blood, right? So we always thought all the problems in the body were going to be the blood, right? The blood. And the blood absolutely has an effect. But for a tissue to be healthy, whether it's your brain, whether it's your liver, all the tissues of the body need a normal blood supply. That's one. Then which I just call neuron poop, when the neuron cells or the tissue cells, they excrete waste products. You have to have a good, which I call a waste disposal system, which is our venous system and our lymph nodes. And then it has to have neurologic input. Like for instance, if you're married, the main input that you have for you is your wife. Like without your wife, so in other words, all the tissues of the body have to have a right neurologic input. Like that's basically what's telling them what to do. It's the brain basically telling them what to do. So if you don't have the right neurologic input, you're totally reliant on the chemicals that are there and So in other words, you're disconnected from central command. So do you think your liver is going to work good if there's no connection with central command? Or your stomach, is your stomach going to work good without input from central command. So that's why I think alternative medicine, it's good, but they're missing that the brain isn't actually help control, fine-tune the liver, the kidneys, the spleen, right? We never talk about the spleen. Well, the spleen's like basically your immune system. You know, we never talk about the spleen. Everybody's got an immune system problem. They got systemic inflammation. So the spleen's not working good. The spleen's not working good because the neurologic input that the spleen's all screwed up. The brain can't send impulses through the vagus nerve because people's vagus nerves are damaged. So then you just get systemic inflammation, right? And you take a lot of curcumin and garlic and all these things, and it's helpful. Like, absolutely do it. I take a bunch of herbal pills. My wife cooks organic. I'm not a great cook. And then you try to, like this morning, I ran with my friend 5 miles, right? So I'm getting socialization with my friend. I'm outside. And then, I'm increasing my vagal tone. But I still need my organs, including my spleen, the brain has to have some control over it. And if your vagus nerves are damaged, it's basically you lose central command. And that's what's happening with everybody. And, they have impulsive behavior. They're all stressed. They they got to do alcohol. They get addictions. They watch TV all the time just to numb their nervous system. Or think about all the people that are on muscle relaxers or medicines to sleep or central nervous depressants, right? Why is marijuana, like all over the world now, everybody wants to be on marijuana, right? Well, you don't have vagal tone. You don't have vagal tone to calm your system down, right? Like, there has to be a reason. It isn't just that marijuana calms your nervous system down. It means that the average person, their body isn't doing it. So they need an artificial substance to do it. So, yeah.
Right. Well, I want to talk about a bit more theory before we get into remediation, but tell me about the trigeminal nucleus, the trigeminal nerve, how it relates to the vagus nerve. I interviewed a biological dentist a week ago, and he's convinced, and him and his mentors, that 70% of all chronic disease starts in the mouth. And that the trigeminal nerve is one of the cranial nerves. It relates to the vagus nerve. So let us know a little bit how those two work together.
Okay. Remember I said that the vagus nerve often is inhibitory. So I'll give you an example. The heart, without the vagus nerve, your pulse would be like 200 all the time, and your blood pressure would be like, 250 over 150. So if somebody has high blood pressure or they have an arrhythmia, right? They have an arrhythmia and nobody can figure out the cause. I'm telling you, it's the vagus nerve. See, the vagus nerve slows your heart rate down. It's inhibitory. It's inhibitory toward the sympathetic system in regard to the heart. So your blood pressure goes down when your vagal tone is good. Like, my blood pressure normally is like 110 over 70. My pulse rate, even in the midst of a busy clinic day, it might be 61, right? So Dr. Hauser, even though there's patients in every room, they're very sick. I do a lot of invasive procedures on people called prolotherapy. Then my vagal tone is really high. So in the cranial nerves, there's 12 cranial nerves, Steve. Cranial nerve 1 is olfactory. Cranial nerve 3, 4, and 6, that moves your eyes. Cranial nerve 2 is the optic nerve where you see. Cranial nerve 5 is a trigeminal nerve. That sensation on the face, and it's like chewing, and then cranial nerve 7 is the facial nerve. That's like the smiling nerve. Then cranial nerve 8 is what allows you to hear, the hearing nerve and balance. Cranial nerve 9 and 10. Cranial nerve 9 is the glossopharyngeal nerve. Cranial nerve 10 is the vagus nerve. Cranial nerves 9, 10, and 11, they run together in what's called the carotid sheath. So if I can check my pulse here, that's my carotid artery, the internal jugular veins there, and then cranial nerve 9, 10, 11. Cranial nerve 9, 10, 11, the cranial nerve 9 is the glossopharyngeal, cranial nerve 10 is the vagus. That's your swallowing. That's like swallowing. Your esophagus, like, it lets you swallow. It also controls your vocal cords. So anybody who has speech problems or their voice is changing or they're choking on food or you feel like food's getting stuck, you probably have, again, low vagal tone. That's what's causing it. Or if you have light sensitivity, like in other words, the light hurts your eyes, or you've had blurry vision or vision changes, or your visual fields aren't quite right, like it's getting dark, like certain parts are getting dark, or you get floaters, like you get flashes of light, or if you have sound sensitivity, the sound of your own voice seems too hot, too loud, or other noises, that sound sensitivity, that also can be a low vagal tone. And then cranial nerve 12 controls the tongue. So I only went through all the cranial nerves just to tell you that the vagus nerve can inhibit all of those. So the vagus nerve has connections with all of them. So anybody who has heightened smell or heightened taste, or your smell or your taste has changed, you probably have low vagal tone. So if you have trigeminal neuralgia, you don't have something inhibiting the trigeminal nerve. Now, the dentist is correct in the sense that you could have dental problems which are irritating the trigeminal nerve. I'm not dismissing that. But you know as well as I do, there's plenty of people who have the same dental work. They have the same dental work as somebody who has trigeminal neuralgia and they don't have it. Well, why don't they have it? They have the same dental work, same dental problems. It's just the other person has high vagal tone. They don't have an injury to their vagus nerves. So again, because of the high functioning of the vagus nerve and all the impulses getting through, they can handle unbelievable stress, even like root canals and metal in their mouth, infection in their mouth, and they don't have any problem. So in other words, what keeps the trigeminal nerve functioning good, not getting too active, is going to be the vagus nerve. So that's kind of the connection. That's the connection. So
great. It just seems like obviously the vagus nerve is the counterbalance to any type of stress, whether it's emotional, physical, whether it's oxidative stress, whether it's stress that comes from cell phone radiation, whether it's stress that comes from blue light. It's the counterbalance. Without the counterbalance, you cannot absorb any of those stresses. I think that's
much better than I've said. I've talked. You said it in a few sentences. No, that's a great word. I'm gonna have to start using. Can I use that?
Absolutely.
No, it's exactly right. Like your wife, if you're married, that she's your counterbalance, and that's so. Yeah, just think if the body just had the stress system active. Maybe that's the way. Or if you had the trigeminal nerve, it was unbridled. Right? Boom, boom, boom. All these sensations, of course, you're going to have a lot of pain. It'll be unbelievable amounts of pain. So,
right. Yeah. Tell us, how do we measure vagal tone?
Okay. Yeah, that's a great thing. I'm going to first go through what you could do on your own self to kind of give you a sense. Okay. So the first thing, obviously, is what is your blood pressure and pulse? Like, again, I said I have high vagal tone, so my pulse is low. So anybody there can measure for 1 minute their pulse, and if your pulse rate's over 90, you have low vagal tone. I'm just telling you have low vagal tone. Or if you have high blood pressure, like recently I had a lady, very thin, she has crazy blood pressure. Her blood pressure maxed out at like 200 over 120, right? So she's thin, she eats organic, she exercises, she has a vagus nerve problem. So if blood pressure is high, pulse is high, that's the first sign that you have you have low vagal tone. Then, you know me, I love looking at uvulas. So in the back of your throat, you shine a light and you go, ah. So what should happen is your uvula should be in the midline, and go on our website to look at me, showing the uvulas. And also, both sides of the palate should elevate evenly. So you could just go, ah, and if one side of the palate is high and the other one's low, where it's low, that's where you have low vagal tone. For instance, the right vagus nerve innervates the stomach. So if the uvula is deviated to the left, meaning the right vagus nerve isn't working, if it's deviated to the left, your right vagus nerve isn't working, so probably you got stomach problems. The left vagus nerve goes to like the heart. So if you've had heart palpitations, boom, 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 and then all of a sudden it stops, that you know that you're starting to have low vagal tone. Then this is my heart rate variability monitor. So I put it on my finger, then I download an app. This is actually Elite HRV. I'm not associated with the company. That's the one I use. And then you do recordings. So you do recordings. You can actually, this is I don't know if you know this, but if you were the very best marker of health in the world, I'm serious, Steve, in the whole world, the very best marker of whether or not you're going to get cancer, whether or not you're going to live a long life, whether or not you're going to get sick in the near future, even if you're going to get an athletic injury, the very best thing is monitor your heart rate variability. And a heart rate variability monitor in American dollars costs like $120. So you don't have to go to a doctor. You could monitor yourself every day, your heart rate variability. Even if you have cancer, you have metastatic cancer. If your heart rate variability is high, you're going to live longer. So everybody, everybody, all your listeners, all your viewers, you have got to learn about heart rate variability. And you can monitor that, your kids, you want to know whether wearing a mask is damaging your health. All you have to do is just monitor for 2 minutes your heart rate variability, put a mask on yourself, and you'll see that the heart rate variability goes down. Why? Because the mask is causing a stress on your body and your heart rate variability goes down.
It
So
sounds
can I
like
explain what heart rate variability is?
Absolutely. I was going to be asked that question. Okay. Explain it.
Yeah. So the very best marker for vagal tone is heart rate variability. So, and everybody can understand this. So the purpose of blood, if we're honest, the main purpose of blood is just to carry oxygen all over the body. It carries nutrients, it carries hormones, and it does all this, but blood is red because there's oxygen in it. If you take oxygen away from the blood, it's black. So when I draw the blood of a cancer patient, or my staff does, it's black. It's often black. Like you can tell right away. And as the person gets healthier, right, they take high dose vitamin C, they do all the natural things. And as they get healthier, the blood gets more and more red. So there's more and more oxygen. So when you take a deep breath in, your heart rate speeds up a little bit, so more blood gets oxygenated. So when you take a deep breath in, the heart rate speeds up a little bit, so more blood goes to the lungs. Then when you breathe out, then as you breathe out, the heart rate slows down. In a really healthy person, like let's say you're healthy, like let's say you do the Comrades Marathon and all that stuff because you're South African, then so a really healthy person, when they're taking a deep breath in, the pulse rate might go up to 80, and when they breathe out, the heart rate for that very short period of time, it goes down to 40. So in other words, when you're really healthy, you have a really high heart rate variability. And what the variability is on the EKG, it's the variability between these two beats and the next beat and the next beat. So when you're slow, deep breathing, you're a very calm person. Between each beat, there's a lot of variability. When you're stressed, boom, 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 boom. Like there's no variability. You're just stressed. Boom, 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 boom. You're not deep breathing. You're just stressed. So like in cancer patients, I'll give you an example with Elite HRV, and I definitely have found that one very reliable. I had a 6-year-old. We were just testing the 6-year-old with masks, like what happens to the kids when you wear a mask. And then everybody was filming. We were filming the whole thing and everything. She's 6 years old. She's not in a calm environment. She's got all these adults and we're filming her and then I'm interviewing her. The whole time her heart rate variability was like 84. Highest I'd ever seen. She's from a really good Christian family, loving family. Then the cancer patients that I test, I'm just telling you, they're like 33, they're 35. Dr. Hauser's usually is about 72 or so. And then the neat thing about it is you can monitor your heart rate variability over time. And then you can also, there's chest straps, you can monitor it during the day. The good thing about it is if you have issues with your mother-in-law, like I don't know if you have issues with your mother-in-law, you could put your heart rate variability on, and when you're talking to your mother-in-law, and if you get all stressed and it goes down, you could tell your wife, I'm just telling you, I can't talk to your mother anymore. It's very bad for my health. And Dr. Hauser is a world expert. I mean, there's so many uses with heart rate variability. I'm just telling you.
That's a good way to measure it, and I found it quite reliable. I use the Aura ring. It's a ring that you sleep on at night, and it measures it while you sleep, which is good. But I think there is a place for the elite HRV. I've listened to a lot of podcasts on that because it's mobile. You can use it in the day and you can trend it and measure it. Give us some readings. I know that it's very sort of specific to people. There are their own HRVs. You can find some healthy people at 60 or 70, others at like 50 or 90. What are the numbers? What should the numbers look like on HRV?
Okay. And Steve, I did write a whole vagus nerve book. It's not out yet, but I mean, it's just unbelievable. Like most of the research, like say they test people with autism, basically any disease, Alzheimer's, autism, schizophrenia, anxiety disorder, and the way they're figuring out, is there an autonomic nervous system component to that disease? They check HRV. Then, so there's a total HRV score, then there's the components of it. Like you can actually divide the actual HRV into the vagal components and the sympathetic components. So the vagal components is high frequency. And you probably know this, we do like autonomic nervous system testing in the office. So I'll give you an example. Well, let me first answer your question. So normally you want your HRV over 70, and there's basically a formula that the various companies use. So healthy is over 70, and I would kind of maybe disagree with what you said there just a little bit. Like you can't go by how you feel. Because like I'll give you an example, and you'll know what I mean once I say this, okay? So let's say somebody likes Aerosmith music, and it's no disrespect to Aerosmith. I'm just going to use them as an example. So say somebody loves Steven Tyler, loves Aerosmith music. What you should, and they'll say, well, why do you like it? And they'll say, no, I feel good when I listen to it. So all I say to them is put your favorite Aerosmith song on and put this on. Like in other words, like let's just say, this is how it could vary, because you could, so let's just say your heart rate variability is 62. Then you put Walk This Way. You put an Aerosmith song on, and let's say you feel good, but your heart rate variability goes down. You got to realize that song is physiologically stressing you, even though you might feel good, because you have good memories about it and and the interesting thing is your wife or somebody could do the same thing and their heart rate variability go up. But just in general, when you listen to like Pachelbel, you listen to Andrea Bocelli, like you listen to heart music. I know it sounds kind of goofy, but you'll see that all those things, symphony music, you'll see that your heart rate variability is going to go way up. So if you have a chronic health problem, you could see where this would help you. You can even eat a meal. Like you could even eat a meal and see like an hour or two later, like is your heart rate variability up or down? So the way you feel can be fooling you. So I would suggest that if somebody is on some herbal things and they're feeling better and their heart rate variability is 55, I'm just telling you, there's still issues. There's still issues. I mean, if you really want to intentionally try to live to be 120, right? The Bible says the maximum lifespan of mankind is 120, and that's proven to be pretty much true. It's 120. So a lot of us should live much longer. We should live into the 90s, live to be 100. If we intentionally, get our heart rate variability high, we deep breathe, and we have a lifestyle that's very calming and encouraging. So Mary and I don't have TVs. We don't have TVs in our house. there's a really heated election. I don't watch any of the election things. I know who I'm going to vote for, but I don't listen to any of that stuff. I don't watch TV. I don't watch the news. Even on YouTube and all that, you got to pick things that are calming and healthy and, like live to thrive. Like you have to intentionally try to live to thrive, because if you don't, and the good thing is with this thing, watch the presidential debates or watch a political show, and you'll see that your HRV is going to go way down. So you intentionally, with your free time, are doing something that's killing you. No, that's basically it. It's killing you. And I would rather do things that are giving me life.
Yeah, great. So that's how we measure, vagal tone with HRV. I think Dr. Hauser's really explained that incredibly well. Tell us how sleep affects HRV and how important sleep is for the autonomic nervous system.
Yeah, if you have low vagal tone, that decreases the input blood supply, nerve activity in the pineal gland. So then you get low melatonin. And if you have low melatonin, you're going to have poor circadian rhythm. So basically, all the organs of the body go through a circadian rhythm cycle, and they're even thinking that every individual cell. Like, in other words, it means that there's a point in time during the day where the liver rests, and there's another point in time where the liver is active. So if you have a low vagal tone, again, that would mean that even during the night, your brain is stressed because there's low vagal tone, so the brain itself can't even rest. So basically, when you have low vagal tone, it screws up the sleep-wake cycle in the body, and then once you don't rest. So basically what research has shown, and this is only since 2013, Steve, you probably know this, but in 2013, there was some Chinese researchers that figured out, they proved pretty much definitively that your brain is like a washing machine, that when you sleep, you basically, the cerebral spinal fluid, which is basically toilet water, right? All the neurons, 1 billion neurons are pooping. No, it's true. They're pooping. And then what they found was the brain goes through this wash cycle. And then that's why when you power nap, because I always wondered what was the chemical that you make during a power nap. Like you do a power nap for 10 minutes, right, in the middle of the day, busy clinical day, and you got 10 minutes during lunch just to take a power nap, and you're so refreshed. Well, it turns out with sleep, you go through one of these washer cycles where the dirty brain water gets flushed out, then there's new brain water, and then all of a sudden your brain's like alive. So I guess in summary, it's the circadian rhythm definitely is screwed up when you have low vagal tone, and that's of course going to screw up the circadian rhythm of your spleen, and then it just makes every toxicity or every stress you have magnified. And we would all agree that that's kind of chronic health problems. They just can't handle the stressors. Ordinary stimuli. So in summary, ordinary stimuli, like there's a conflict at work, ordinary stimuli get heightened, so the person blows up. So any person who's watching this, where you just can't handle stress as much as you used to, you probably have low vagal tone, so you have to get it corrected.
And as you age, it's shown that your HRV slowly decreases, so your ability to cope with stress decreases, and the people that are sort of on the older side can attest to that. Your sleep affects your vagal tone, and your vagal tone affects your sleep. Is that correct?
Yeah, that's correct.
Great.
Yeah, sleep is for restoration, so obviously if you're not sleeping, your body can't repair itself, right, basically. And I should say that too, the vagus nerve is what, like say you do a workout, right? I did a 5-mile run, then obviously I caused some tissue damage during the run. So it's my vagal tone that's going to help me recover quickly. So if you notice that you don't recover as quickly from workouts, like you're more tired or you're more achy just from a normal workout, it means that your reparative ability is lower, your vagal tone is lower. So the vagus nerve is the nervous part of the nervous system that initiates repair.
Yeah, great. I mean, I know that Cristiano Ronaldo and Messi use HRV in the morning to, you see how hard they can train because they possibly got an infection that comes on that tells their trainers and tells the coach that possibly they can't train as hard that day. So I think it's been used for performance for a long time, HRV and vagal tone. And let us discuss the remediation, starting with cervical instability, which is obviously you're an expert in that field, and other remediation tips, what people can do from breath work to meditation and so forth.
Yeah, so in summary, let's say my vagal tone is normally 72. And then even if I wake up and I feel decent and all of a sudden my vagal tone's 62 in the morning, right? So that would mean that I better get some extra rest that day, and I gotta not do a really hard workout, even if it's planned, because my vagal tone is lower that day. So my ability to repair itself is gonna be lower. Or maybe I gotta eat healthier that day, because I kind of like fried foods. I know I'm not supposed to say that on this show, but no, so let's first talk about the structural cause of low vagal tone. So remember I said that the vagus nerve, the brain, sit right in front of C1 on both sides. So your brain, your head, your skull sits on top of the cervical vertebrae. Because of forward head posture, the top vertebrae are now forward. And so what's happening is people are losing their cervical curve. And so the cervical curve is supposed to be a C, but because of cell phones, the cervical curve is getting reversed. And because of that, everything's getting stretched out. So the vagus nerve's getting stretched out, the spinal cord's getting stretched out. When nerves stretch too much, the nerve conduction within them gets blocked. For instance, your stomach could be sending signals to your brain, but if the vagus nerve impulses are blocked because the nerve is getting stretched or compressed, the brain doesn't know that what's going on with the stomach. So cervical instability means, for instance, that the connections between the bones are loose. So a person moves their head and then the bones move too much, and then the bones can compress like the vagus nerve, put tension on the vagus nerve. And when nerves get too much tension, again, the nerves can get injured, neurons can die. So they've definitely shown that stress can kill vagus neurons, stretch can kill vagus neurons, compression can kill vagus neurons. And when neurons die, you got to realize, for instance, just to take the GI tract, do you know, Steve, one vagus neuron goes to up to 5,000 enteric neurons.
Wow. Sure.
Like 5,000.
Wow.
So in other words, I think it's like 5 million. I think there's something like, no, it's 100 million. Yeah, that's right, 100 million. So think about this. There's only 100,000 vagus neurons, and they go to not all of them go to the digestive tract, but there's 100 million enteric neurons. So that means one vagus neuron, if you knock it out, you could knock out 5,000 enteric neurons. Yeah. And then, and we didn't talk about this, but the enteric neurons, when you knock them out, you basically get leaky gut. Mm-hmm. Everything you talk about leaky gut, if you have low vagal tone, and they've shown this in animals, if you cut the vagus nerve, you get increased intestinal permeability, right? Everybody's got multiple chemical sensitivities, food allergies. It's like, what causes it? Why does this person have it and that person doesn't? We've always thought in alternative medicine is crappy diet. That's part of it, but I'm just telling you, because of the cell phones and the changes in the cervical curve, you're going to see that ultimately there's probably more of a structural component than a food component. It's caused because the enteric neurons are dying, and then you get the tight junction goes, then you get all the food sensitivity. So if you want to actually cure it, so a person can eat more than 10 foods, you got to correct the looseness. So So we do what and everybody could research this. Go to caringmedical.com. We have a YouTube site. But basically, we do digital motion x-rays. So it's like a video camera, and we have the person move, and you can see the looseness in the neck. And then there's only one treatment in the world that's been shown definitively to tighten ligaments, and that's called prolotherapy. Prolotherapy is an injection of natural substances. We can use stem cells, we can use PRP, we can use the normal sugar in the body called dextrose and other solutions, but it induces the ligaments to tighten. The ligaments tighten. So imagine like a kitchen cabinet and one hinge is loose because the screw's loose. If you keep using it, that kitchen door, cabinet door, the other hinges get loose. That's why people have like neck pain or headache, and it just seems like it gets worse and worse and worse, and it spreads. Because once you get one connection of the vertebrae loose, the next get loose. And it means that every time you turn, you could be compressing your vagus nerve. So the treatment for cervical instability or loose neck is going to be prolotherapy. So that's the structural cause. Another structural remedy is what we call curve correction. And you know, there's a lot of really good chiropractors. I'd recommend going to a chiropractor that doesn't do high velocity manipulation because that could injure the ligaments. But there's a lot of good chiropractors out there that do curve correction, you know, that do different things to correct the curves. And again, go to our YouTube videos about what curve correction is. And then there's a lot of things people can do at home. And you know a lot of these. Probably on your show, I'll be honest, I haven't watched any of the shows, but I probably should, right?
You should.
No, but anyway, you know, probably every show that you're doing, in essence, you're doing things that increase vagal tone. Mm. So on the various websites like Elite, you download Elite HRV app or other apps, and they'll do what's called pace breathing. So they've shown that you'll get the highest HRV with a breathing rate of 6 times a minute. And you know, most of us breathe 15 times a minute. So you just do pace breathing, meaning that you slow your breathing rate down. So think about that. 6 times a minute would be 5 seconds in, you know, 5 seconds out. Yeah. No, and anybody who breathes that slowly, you'll see, man, your brain function's going to get better. You know, your calmness is going to get better. And remember I said we do autonomic nervous system testing in the office, so you'll like about what I'm going to say. So we had a patient who's had done a lot of counseling, a real lot of counseling, you know. And she had, and a lot of gals have been in really abusive relationships. Like, let's be honest, there's a lot of bad guys out there, you know, and there's a lot of bad guys and a lot of good gals. They just got into like terrible situations. So this gal had gotten some physical abuse and other things. And then we're testing her. And again, you got to realize years of counseling, I'm doing well. And all Kathy in my office said was, here, I want you to think about one stressful memory. And I'm just telling you, within like, you know, 10 seconds, her HRV changed to where it was something like 16 times the sympathetic tone to 1 time the parasympathetic. Wow. Wow. Okay. Sure. So you understand, like with one memory within 5 or 10 seconds. So, you know, and then she said, what were you thinking about? And then she thought about, you know, getting strangulated by the boyfriend. So I'm just telling you that stuff's in there. So you need this because that person isn't free. You know, they're not free from that stressful memory. Then later in the test, Kathy got her to laugh. And you know, again, within about 10 seconds of her laughing, her nervous system was completely balanced. Wow. Wow. So when they done HRV tests, they found laughing, humming, deep breathing, aromatherapy, you know, lavender. No, they've shown it. And you guys can show it yourself, right? Put an HRV monitor on, you know, go out with some friends, have a really cool friend, start laughing, and you'll see your HRV. That's the neat thing about this. You can prove anything.
Mm-hmm.
You want to know whether a certain person is good for you or not, just have your HRV on when they're with you, and you'll know right away, like, this is a person who, if I spend too much time with them, it's going to give me life or it's going to give me death. Because the lower your HRV goes, your mortality rate, you guys can research that, the very best measure of whether you're going to die in the next year or something is going to be your HRV. You get your HRV really high, you'll be able to handle unbelievable amounts of stress.
Yeah, incredible. And it's so dynamic. I'm going to sort of put in the show notes the Elite HRV, the app, and just get some out to my community here in South Africa, because it's so dynamic. The Aura Ring is great, but it's only while you sleep. It does trend. It does show you what's happening to your HRV over the evening. But that's just so dynamic. Can be used 2 minutes, 5 minutes, and very, very practical. Give us some other ways, that you can improve HRV. We've said chanting and humming and singing. I find that when I'm outdoors and I'm in the sun and I'm not in the Wi-Fi, areas, or using my cell phone, my HRV improves significantly at night. It goes up to, say, sometimes on average like 90, 95, 100 when I've had an outdoor day. So tell us some other sort of tips that people can do.
We should say, too, the vagus nerves have incredible regenerative capabilities. I would even say this, the vagus nerve helps. They've shown this in animals. You got to realize a lot of these studies are in animals because you can't sacrifice a human being. So they've shown that, like, say you have a nerve that's not regenerating, well, the higher your vagal tone, the more that nerve can regenerate. So the vagus nerve is very much involved in regeneration, even involving regeneration of nerve tissue. Like when they do vagus nerve stimulation, they find the parts of the brain that have to do with higher cognitive functioning, the frontal lobes, the anterior cingulate cortex, the cortex of the brain, their blood flow, their nerve conduction increases. So again, there are vagus nerve stimulators you can get. There's ones, you just go on Google or go on a search engine, there's all kinds of vagus nerve stimulators. So we sometimes with the patients have them buy, a vagus nerve stimulator, and then they stimulate it like 45 minutes twice a day. There's different protocols. This is interesting. I think this, right where you have your earbuds there, that part of the ear is innervated by the vagus nerve. So you can actually, you don't have to have a surgical implant. Yeah, right there. That's actually, so you can actually stimulate any sort of electrical stimulation right there. They've shown that it goes actually into the brain and increases the parts of the brain that have to do with problem solving. And then when you do vagus nerve stimulation, the parts of the brain that have to do with impulsivity, like the limbic system, where the limbic system, like the person's too emotional, they have anxiety, those parts of the brain, the blood flow and the nerve conduction goes down. So basically helps a person really control their behavior better and make better decisions.
Wow, that's fascinating, because if you put a Bluetooth device in here and you're getting all the radiation and you're getting the damaging effects of Bluetooth, or you're putting your cell phone right here, which is huge radiation, you could cause significant problems to the vagus nerve.
Yeah, exactly. No, I didn't think about that. I don't know if that's been studied. I'll have to research that, but no, it should. It probably will.
Yeah, it has. I mean, there's over 10,000 studies. I've just done some recent podcasts, and, with Dr. Hauser being on part of our scientific board at Made to Thrive, he's going to start researching the effects of radiation on the vagus nerve. Dr. Martin Paul, he's shown what happens to the voltage-gated calcium channels of the cells. You get an influx of calcium straight into that cell from all this radiation. So if we're putting Bluetooth devices right here and we're affecting the nervous system via all this radiation, we're going to cause damage. Yeah,
exactly. So I just wanted to make the point the vagus nerves can regenerate. So anything. So the first thing is, obviously, a person has to reduce why they're getting damaged. So just as an example, and again, we do testing in the office. So we figure out, like for a computer screen, many people would benefit if they were actually looking up. So I'm not right now, I'm at my wife's computer screen. My screen, I would actually be looking up. So for the way my neck is, if I'm looking up, that's helping me get my curve. So, and especially children, you cannot have children just looking down at a tablet, because that's why many kids, their neck curves are changing and their behavior's out of control. It's just one example of, technology actually hurting the children.
Yeah.
So when I was growing up, I'm older than you are, we looked up at the teacher. We didn't have tablets, we didn't have cell phones. So our necks were more protected. You have 2-year-olds looking down at something when they're supposed to be looking up at adults,
Yeah.
So first you got to reduce the stressors. If they're doing toxic eating, toxic behavior, toxic relationships, many people, as you know, Steve, they have a toxic relationship with themselves. They don't love themselves.
Yeah.
So you have to get rid of the stressor. Then they've shown in animals, for instance, when the animal exercise, does moderate amount of exercise, they actually regenerate their vagus nerves. You can actually get the neuron population to be greater. So exercise does it. They've shown that when you walk your dog, they've done HRV tests with just pets, petting pets, walking pets, being outside, like you said, holding hands, hugging. Anytime you criticize something, every time you complain, and again, test yourself. Every time you complain about a political candidate, your neighbor, your spouse, your HRV goes down. They've even done when moms bottle feed instead of breastfeed, when a mom bottle feeds, the HRV goes down in the baby and it goes down in the mother. Wow. When the mother breastfeeds, so how women, they pump? Yeah. So when they've shown that when a woman pumps, her HRV goes down, then they feed the baby's HRV goes down. When the mother breastfeeds, the HRV of the baby goes up and the HRV of the mother goes up. You got to do natural. Every time you compliment somebody, your HRV goes up. Every time you say a positive affirmation, and some of us, we got to do positive affirmations about ourselves. Yeah. Because we believe all these lies, that society tells us, our past, all that stuff hurts your HRV. So you got to make sure, programs like this, that are teaching us about how to have the right attitude about ourselves, positive attitude, and then our nervous systems get more imbalanced, and then we can handle stress better. So it's harder and harder for our bodies to get damaged by stress, and then we thrive, right? We help other people have a healthy lifestyle, and it's like a catch-22. Once you get into health, right? I always call it like the life-giving business. Can I just tell you something that might be meaningful to you? It's actually a little bit off the topic, but there's 3 Greek words. Like if you read the Bible, there's 3 Greek words for life. One of them is called bios, where we get biology. The second one, which is physical life. Then the second one is psyche, where we get psychology, which is like our soul. That's like emotional. So there's like emotional life, there's physical life. And the third one is called Zoe. That's actually the Greek word Zoe, which is eternal life. And me, I'm a Christian, so I think it's very, very important to have faith. And I'm just going to say something very much where anybody of any religious faith can understand it and believe it, which is just that God could have created a universe where Steve wasn't in it, or I wasn't in it, or you weren't in it. In other words, God could have, created a universe where we weren't in it. But think about it. Once he created the universe, the Big Bang, or however the universe started, then he knew that Steve was going to be on the earth and I was going to be on the earth. And just knowing that, it means that I have significance. I have eternal significance. So when I was in med school, I really went on the quest, does God exist, does not? And I believed that, Jesus was who he said he was, and I turned to him and had faith in him and became a Christian. And the reason why I read my Bible and I go to church is just that I want to be in an atmosphere where there's other people who want to have family, who want to have community. Community is another way that you increase your vagal tone. So Marion and I, we get together with our tribe, if you will, our 6 friends who are our tribe. So we have a meal together, and we intentionally do this. We have a meal together on Wednesday nights. So in other words, we have a meal together, and then we talk about things that are going on in our lives, and we do a little bit of a Bible study, and then we get together on Sunday. So twice a week, we're getting together with our tribe, and I think that's part of what's missing in people, that faith component, that community. So I'd really encourage people, if you want to have good vagal tone, that's really an important aspect of it, is you have to come to terms with, what is my purpose on planet Earth? And if God wanted me on planet Earth, that should be what gives me my identity. Like the God of the universe felt I was significant enough to have me be here, and I have something to do. And the main job that God wants us to do is to help other people, which I kind of call relieve human suffering. It isn't just a physician that's supposed to relieve human suffering. We're all supposed to be there for each other. So when there is an issue, the person knows that they're loved, and that there's help available, and that they're significant.
Incredible.
And if we just do that, we'll make the planet a lot better.
Incredible. And you've just summarized the 2 most important pillars of Made to Thrive. And one is purpose and the other is community. Because I believe that those 2 pillars are the most important for people to thrive. Because without a purpose, you're not going to try and increase your vagal tone and eat nutritious foods, or go for that exercise, or go for the walk, or do the meditation, or get to sleep at the right time, or wear the blue blocking glasses if you don't have the purpose. And if you're not using your purpose within a safe and celebrating and united community, then you're not serving other people. So community and purpose are the 2 most important pillars that Made to Thrive. And we then base that foundation on all the other actions we do to ensure that we firstly nourish ourselves and then we nourish others. So I think that was really summarized by Dr. Ross. In summary, going for a walk, animals help your HRV and your vagal tone, nutritious food, getting outdoors in sunlight, avoiding radiation, your electromagnetic radiation from Wi-Fi's, from cell phones, that helps your HRV, being positive and affirmations, being optimistic in terms of that will build up your parasympathetic nervous system. I think there's a lot there for people to digest. It's all going to be in the show notes. We're going to write those down. And my last question that I ask all my guests, and you're more than a guest, you've been my mentor for 10 years, and you've been a great friend for many, many years, and you've helped me in my own personal life and my business life, is many people put habits and healthy lifestyles together for a short period of time. For example, the research shows that people would lose weight, and then within 6 months or 2 years, they've gained the weight back and they've put on even more weight. What are some key internal drivers that help people maintain their sort of sustained transformation?
Yeah, that's a great question. A lot of it gets back to community. Everything is intentional. So you have to have intention, and you have to know where you're going. Good example is, I always think it's very, very important to finish things. Most of the things, what you're talking about, is people don't finish things. And, I wrote a 2,000-page book on joint instability, right? So, I'm going to finish it. It is going to get published. I actually did finish it. It's getting edited. So, and you have to know, why is it that you're doing something? Most people, they just go along, and if they're honest, their life isn't ideal. So then, I'll give an example. In 1999, I realized I didn't have a best friend. I really needed a buddy. So I started praying for a best friend. It's just taking an inventory in your life. Is it to thrive? What do you need to do? And then you have to be accountable by somebody. In the Bible, that's called discipleship. But the point is, you do have to have mentors. You do have to have somebody who you're accountable to. So right now, you don't know this, but in the next few hours, I'll talk to one of my patients who I'm trying to mentor, and he wants to get mentored. And then my nephew, once a week I talk to him. So those of us who are able to, we mentor other people. And some people, you just need to be mentored, or you need to be accountable. Because let's be honest, if you're not accountable to anybody, like think about it, you're not accountable to your boss, you're not accountable to your wife, you're not accountable to anybody, you can accomplish something, but it's not going to probably have the follow through. So figure out who do you admire, try to get under their wing, talk about goals, and then, and then have a plan. You have to have a plan.
Great.
And then honestly, people usually fall off the wagon, but it's because of stress. It goes back to, they get stressed, right? And then they don't do the diet. And so I would just say that it's accountability. I would say that's the major thing. And obviously from my standpoint, I believe God has me on the planet for a purpose. So my purpose right now is I have an office. So I always believe that when a patient comes in, it's an appointment from God, right? So if you're in business, all of us deal with the public. So is it by coincidence they came? Or maybe look at all your customers as appointments from God. Imagine God himself called a person at Walmart and said, hey, this lady's coming in, she's going to be in your checkout at 7:30. Like, would you maybe treat them differently if God called you? But if we just look at that, and from the Bible, we're supposed to believe that everybody is made in the image of God. So that means every human being, even the person that you hate or you don't like, or you feel like they're enemy, they're still made in the image of God. So you're supposed to treat them with honor and dignity.
Yeah.
So I guess in summary, it's feeling like there's a higher purpose and everything I do is significant. And having, like my wife, obviously for me, a lot is my wife, like she helps keep me on the straight and narrow. And then the tribe, whenever I'm struggling, I just tell the tribe. And then the tribe, my friends, my community, help me try to figure out how I can get back on the diet or back on, right? Because if you don't have that, there's nobody telling you, dude, you got to get back on the thing. Like, what can we do to help you?
Incredible. Yeah, that's fantastic, Dr. Ross. I mean, purpose, community, your tribe, helping you along the journey to continue the things that God has planned for you in advance. Wonderful. And what a privilege, what an honor it's been to chat to you and to get this wisdom. I think a lot of the audience and the viewers are going to have learned a lot about HRV, a lot about vagal tone, a lot about the autonomic nervous system, how stress is involved or related to 90% of all chronic disease, your immunity amongst this, this fascinating pandemic and what it's done is that when you've got great vagal tone and a really, really strong immune system, you don't have much fear. You don't have to worry about these viruses running around. So thank you so much, and look forward to chatting again. Head off to caringmedical.com. I know you guys are on Instagram and Facebook. Tell us about your social media handles.
Yeah, I mean, obviously you want to hear more about, some of the innovative things we do. Subscribe to Caring Medical on YouTube. And then, we have a newsletter. So obviously go to caringmedical.com. And if you want to receive our newsletter, I do a lot of research into brain function and brain blood flow. And, I think it would be an adjunct to your viewers just to get some of that information. We do blood flow studies and autonomic nervous system testing. And, we do so many innovative testing procedures at Caring Medical. So I think your viewers would appreciate that.
Yeah, well, even we hit the top charts on health, on Apple charts in Jamaica recently. We had a lot of listeners in Jamaica. We've got a growing audience in the US. So anyone who needs any work on cervical instability, please go to caringmedical.com. And to Dr. Hauser, he's a health hero. He's a true pioneer. He's an author. He's written so many books. He's just a wealth of information. I salute you. I honor you. And trust that much favor and blessing just fills your life.
Thank you, Steve. Great. Thank you for having me on.
Great.